All right, welcome everyone, and thanks for coming today. We're really happy you're here. We're thrilled to be back again today with Neil Pearson. Just to introduce ourselves, I'm Jen Hansen. I work at PNBC, and Neil Pearson, who's a physiotherapist and therapeutic yoga instructor, is also here to instruct. If you joined us last week, you will have likely seen one of Neil's wonderful classes. Today, I just have a couple of reminders. We'll do this really quick because many of you may have heard this before, but just so you know, the session's being recorded. We're going to try to live stream on Facebook, but there has been an integration issue between Zoom and Facebook Live. So we're not sure if we can do that. However, we are recording and we will post the video to our Facebook page after, and also our YouTube channel. We do have a poll that we just ask you to stick around and complete at the end of this, just to let us know how you found the session. And if you've got any questions, just email education@PNBC and we will try to help you. Just a reminder that we're going to be meeting again tomorrow at 11 o'clock, again with Neil. And then next week we have 3 more sessions, also with Neil, and then a couple of our collaborators, Sue Schelling and Rebecca McDonald. So we're excited to have them. I am now going to turn it over to Neil and we'll get right into it. So again, thanks for coming. Thanks for being here. It's terrific that everyone is able to do that. And I hope you enjoy the session today.
Thanks, Jen. And yeah, thanks for everyone for coming back and for giving us feedback. I guess I want to start by saying we've been listening to the feedback. So if you were here last week, you heard someone asking a question about if taking their attention to their breath was causing more anxiety, really what to do. And I think there's a great question to extend it a little bit further to, if any of the practices we're asking you to do here do not feel safe, or you start them and they're creating something that seems like it's exactly the opposite of what you want, or just creating something that you don't want, the best thing to do is pause. I wish we could answer you the questions for you right away, but you could send it into PNBC and maybe we can help you a little bit after the session. Thanks for being patient with us as we try to work out how to integrate this and help you as much as possible. I guess one of the other things that's important here is with these movement classes and with the movement practices that you do at home, is that success is really doing them in a way that when you finish, you feel like you've accomplished something and you haven't left yourself provoked. Or to say it another way, is you may have had a little bit of increase in say pain, or maybe you felt your energy being used up a bunch while you were doing the activity, but when you stopped, you felt that it didn't take that long to recover your energy, or it didn't take that long for, say, your body tension to start to come back to normal again. So that's really the success we want you to go for here. Success is definitely not about just doing whatever somebody else is telling you, especially in this medium where we can't give you that advice right away. So hopefully you can sort of stick with that. Now I'll keep on saying things like, and I know the other presenters are as well, saying, pause, check in, see how you're doing. Maybe now's the time to say that's enough for today. Right? That we're trying to give something that will work for a number of people. So today, just to let you know where we're going to go. We're going to start seated like this. Of course, if seating doesn't work, you feel free to actually start standing. We're going to start seated, then we're going to move to a standing position. And when I get there, I'll remind you that you can sit back down if you'd like to anytime you want. You don't have to stay standing. I'm also going to do it so I've got this chair. I've got this nice chair here that I'm sitting on that I'll move to the side that I can use for balance. You may not be able to move your chair around, so you may need to stand beside it, but we'll talk a little bit about that. And anytime you need to use the chair for balance, or use the chair because, say, that there's troubles in your ankles or knees or feet or hips, go ahead and do it, and I'll show you how to do that. All right, so if you can, find a place where you can sit with a bit of a tall spine. Best to have your feet resting flat on the floor. So you can feel your feet on the floor. You can find that length of your spine. And if your shoulders feel tense at all, just see if you can let a little bit of that tension go. Just try to move your shoulders or let them relax down. If you feel tension in any other part of your body, see if you can let that go just a little bit to start. And we're going to do a different breathing practice today. So this breathing practice gets us to take our breath into different parts of our body. So the first thing I'd like you to do is just put your hand up over your sternum area. So pretty much over the breastbone. And just as you breathe in, see if you can create a sensation that you're actually breathing into that part of your body. So you're expanding your chest as you breathe in. And then as you breathe out, just let it soften. So if your hand is there, as you breathe in, you feel your chest sort of expanding out towards your hand. And as you breathe out, you just let it soften back in. Now, as you're expanding here at the front of your body, see if you can do the same thing at the back of your body. So it's almost like if this was the front and this was the back of the body and I was facing over that way, that as I was breathing in, I'm feeling my rib cage go like this. Now, it's not going to move a lot, but you can feel that movement. So you feel that expansion front and back around the chest. When you breathe out, let that go. Now take your attention to the sides of your ribs. And as you breathe in, create a sensation, let your ribs move out. So feel your ribs sort of being drawn out to the sides. They're not going to move like this far as I'm showing with my hands, but just feel your rib cage going out to the side. And as you breathe out, just let your ribs relax back in. So rather than feeling the movement here, now you're feeling the movement at the sides of your rib cage. Maybe you can feel it all the way from down to the side of your abdomen, all the way up to under your arms. You can feel the rib cage sort of moving this way as you breathe in, and then just relaxing as you breathe out. And then what we want you to do is take your hand and put it over your belly. And as you breathe in, just feel your belly expand out towards your hand a little bit. And as you breathe back out again, just let it relax again. Now, even with doing something as simple as these different breathing patterns, you may have found, say, you did the chest and it didn't feel good. Well, what you could do is, as we move forward, is you could focus on the movement in your belly and the movement in your ribs. Or there are some people who don't like to focus on their belly when they're moving at all. So it's okay to actually work on the sides of the ribs and the chest. So if you're able to do the full breath, we're going to call it 3-part breath. But as I said, maybe you want to do 2-part breath. So you have to make that modification for yourself. But if you can do the 3-part breath, the way we actually start is from the bottom up. So just start the 1 breath, feel your belly expand, and then relax to breathe out. Your next breath, take your attention to the sides of your ribs, expand there as you breathe in. As you breathe out, soften there. Next breath, come up to your chest, and as you breathe in, expand in your chest. And as you breathe out, relax. Now start down at the bottom again, but slow it down a bit. Not really slow, but a little bit slower. 1 breath, breathe in slowly, softly, breathe out, relax in your belly. Next breath, go to your ribs again. As you breathe in, expand them to the sides. As you breathe out, let them soften again, slowly. As you breathe in your chest, do that longer, smoother, softer kind of breath there. And then when you breathe out, relax there. Now the next breath, you're going to try to do your inhale. Breathe into your belly, then breathe into your ribs, then breathe into your chest. And as you breathe out, just let it relax. So try that a few times. It can take a little bit of practice to sort of get this. So as you start your inhale, you feel your belly expand. As you then go on, you feel your ribs cage expand. And then you go on, you feel the top of your chest, the top of your torso expand. And as you breathe out, you just soften, let it relax. Sometimes people like to do this almost like it's 3 actual parts. So you breathe in your belly, then you breathe in your ribs, then you breathe into your chest. Other people like to do it so it feels like it's almost like a wave coming up. You feel the lower torso expand, then the mid torso expand, then the upper torso expand. And as you breathe out, you let it relax again. So you can play with different words as you're doing this, but expand to the bottom, then to the middle, then to the top. And as you breathe out, let it relax. Just try that a few more breaths. Breathe in your belly, then breathe into your ribs, then breathe into your chest, and then soften. Now remember, you can pause anytime you want. So if you're losing your breath, let the breath go and just pause. If you want to carry on, you can carry on. If this feels like it's enough, stick with this. If you want to try one little bit with this, what you can do is turn your exhale into 3 parts. So as you breathe in, you expand your belly, then your ribs, then your chest. And as you breathe out, you're going to go back down again. You soften in your chest, you soften in your ribs, you soften in your belly. So you breathe in, expand on purpose your belly, then expand your ribs, then expand your chest. As you breathe out, try to release the tension around your chest, then release the tension at your ribs, then release the tension around the lower torso and abdomen. So it's 3-part breath on the way in, 3-part breath on the way out. So expanding from the bottom up and releasing from the top back down again. Now, if you're able to do this, if you notice your body getting tight, or if you notice anything getting tight, see if you can let that go and try it for a few more breaths. Wish I could show you, but it's really hard in this medium to see this kind of movement because there's not that much movement. All right, so the next time you finish your exhale, just let that go. If you need to shift around, if you need to stand up or stretch or move, go ahead and do it. And do one more thing while you're seated. So once you're back to sitting again, once you stop shifting around again, and take your time if you're stretching something that needs to be stretched, then try to find that tall spine again. Feel your feet on the floor, soften around your neck and your eyes and your face and your jaw and your tongue. And then come back to that longer, smoother, softer breath that we've talked about. And each time you exhale, we're going to try to get you to decrease a little bit more tension in your body. So next time as you exhale, feel the tension releasing from your legs and your feet. Like you're finding some softness, you're letting go, whichever words make sense. Each time you breathe out, just releasing in your legs and feet. Then shift up to around your hips and your pelvis. As you breathe out, release tension around your hips and your pelvis. It can be hard to do this at first. And with practice, you'll find you'll be able to release more and more. You'll really feel that sensation of letting go. And at times when you feel your energy is less or your pain is more, it can be harder to do. Keep working on it as long as it's feeling good, as long as you feel like you're going the right direction. Now shift up to your torso, and as you breathe out, release tension in your torso. Each exhale, just making it soft, letting the tension release. It's hard to do this without slouching while you do it, so see if you can keep your spine up a bit tall. Now shift up to your shoulders and all the way down your arms into your fingers. As you breathe out, release tension there. Maybe you can get more and more tension released each time you breathe out. Or maybe you're still waiting for that first sensation of tension to be released. Stick with it. And then try the same thing around your neck and your head. As you breathe out, release tension around your neck. If there's tension in the back of your head or in your forehead, let that go. Maybe it's in your temples. And then do the same thing around your face. Scan through your face and release the tension that you might have around your eyebrows, your eyes, your cheeks, even around your ears, around your jaw. If your tongue feels like it's gripping or tight, see if you can soften it. And then once again, when you're finished with that, just if you want to move around, shift around, go ahead. If you want to stand up, that's fine. I'm going to stand up now because for those of you who are okay with it, we're going to come to standing and do a few things in standing. So I'm going to move the chair here. I'm just going to move the chair over to the side. So anytime I need it, I can just put my hand out and put my hand on the chair for balance. But mostly I'm going to stand. For me doing this today, my balance is all right. If your balance is okay, then you can do it without your hand on there. But if you're unsure or if you have pain that might actually affect your legs or hips, then have that there because it could give you a little bit of a relief if you need to get that. So Once you're standing, what I'd like you to do is find a bit of a length of your spine again. So that same idea as you were sitting, try to create sensation that your spine's a bit tall, like your neck is growing a little bit tall, almost like you're a one-string marionette, like someone's pulling you straight up at the top. You can feel a bit of length in your legs, a bit of length in your spine, a bit of length in your neck. Your arms are relaxed at your side. You can feel your feet on the floor. There's a lot to do, right? Feel your feet on the floor. Feel the length of your legs. Feel the length of your spine, the length of your neck. Shoulders are relaxed. Scan back to your face and jaw and see if that's all relaxed. And then try that same 3-part breath here, or whatever breath you were doing that seemed to be the best. Maybe you're doing 2-part, or maybe you're doing 3-part, but see if you can do it here in standing. So as you breathe in, if you can, expand your belly, then your ribs, then your chest. And as you breathe out, release in your chest, then release in your ribs, then release around your belly. And just do that a couple times again. And then just like you were sitting before, let go of that breath and just let your breath flow as easy as it can, and make your breath a little bit longer again, a little bit smoother again. And scan through your body really quickly. Now that you're standing, are there different parts of your body that are tense? So see if you can release any tension you don't need in your legs and feet. Release any tension you don't need around your hips and your pelvis. Release tension you don't need in your spine and your torso. Release tension you don't need in your shoulders and arms. And release tension you don't need in your neck and your head and your face. Now you may not have released it all, but do as much as you can. See if you can just keep on working on this, trying to get that tension to release. All right, so remember, you can sit back down anytime you want to. You can shift around anytime you want to. You don't need to wait for me or any of the other instructors in this to say change your position. If you're losing your energy, if your breath is getting too tight, if your body is getting tight, take a break, pause, release the tension, use the breath practice, use the body tension releasing practice, whichever one that you found is best. And then when you're ready, come on back. Or maybe decide that's enough for today, and what I'm going to do is just listen and imagine doing these movements. So if you're standing, we're going to start with just some simple movements of your arms. So you've got your feet on the floor and you've got your breath a little bit calm. You're paying some attention to your breath. You're noticing your body tension. Just to start, take your arms up in front of you and then bring them back down again. So you may find that lifting them only this high is as far as this feel right for you today, that's fine. Or you may find that lifting them way up in the sky feels good. But as you do this, what I'd like you to do is to notice what happens in your breath and notice what happens with the body tension. If as your arms go up, your body's getting tight, then see if you can keep that tension a little bit less. Whereas as you go up, if your breath gets tight, see if you can keep your breath flowing. And if you feel you can't, then it's okay to not lift so high. Or say you lift your arms up and you can feel your shoulders ending up there. See if you can try to do it without lifting your shoulders up. Maybe you don't lift your hands as much. The idea with all these movements is to see how much can I do this while I keep my breath flowing? How much can I do this while I keep the body tension from getting so high? And there's nothing wrong with more tension as you lift your arms up and come on back down again, as long as when you come back down again, it actually softens again. So we're going to try this. Next time you breathe in, take your arms to the front and let them down. When you breathe in next time, take your arms to the sides and bring them down. And when you breathe in next time, take them up to the front again and then bring them down. And then this time, let your arms relax as you take a breath in and a breath out. Shift around if you need to. Move your feet if you want to. Let's try that same thing again. All right, so the first breath. Breathe in, take your arms to the front, however high feels good, and then let them come down. Next breath, take them to the side. And as you breathe out, let them come down. Next breath, go to the front again. And when your arms come down this time, you're going to let your arms relax. Take another breath in, another breath out, and let that tension go, either with your breath or by shifting your arms around a little bit. Now we're going to start to move the spine, and you're going to still pay attention to your breath. Notice if it gets tight, know if your body gets tight, and then see if you can change that if that's happening. So the first movement is a really small movement. It's like slouching from standing. So I'll show you from the side. You just do this kind of movement, round your back, and then come on back up again. So as you're rounding your back, you're going to let your chin come down towards your chest, and then you're going to come up. Now, some of you might like a really small movement, and some of you might like to move a lot more, to do more rounding. That's fine. If you know what your back does best with, stick with that. And remember, you can pause anytime you want, but just let yourself come into a bit of a rounding of your back and then lifting your spine back up. And as you do this, you'll probably notice that your breath starts to sync up with the movement. Now, you may breathe out while you round down, or you might breathe in. Just do whatever feels fine for you right now. Just keep your breath flowing as best you can. And then pause. Shift around if you need to. Remember, you can keep a hand on that chair if you need to. So the next movement is going to be going backwards. So you either put one hand on your hips or both hands are on your hips. And this time you're going to come into a bit of a back bend. So you're going to back bend this way and lift your head up if it feels okay. But if it doesn't feel okay to lift your head up, just keep looking straight ahead at something that's on the wall in front of you. And so you're just gently moving your back. So before you're rounding it forward, now you're trying to find your back moving into a back bend. So it could be as little as this. That's fine. If that's the right thing for you to do today, enough so that you don't go too far, do it that way. Or maybe you like to move further, right? So you can decide for yourself. And if your balance doesn't feel good, remember, get your hand back on that chair, so that'll help out. Now, once again, pause, shift around. Remember, you can sit and take a break for a moment or stick with this. The next movement we're going to do is a bit of a side bend. So if you're all right with your hands on your hips, have them here, or one hand on the chair. You can have your arms resting at your sides if you want. Choose one of those two for now, and just let your spine start to bend to the side. And then come on back up. Small movements for now. Just get your spine moving a little bit. So when you're finished with the one side, come on back over to the other side and start to do that side bend on the other side. Just go down to whatever feels good and then come on back up again. And then let your arms rest, shift them around a little bit. Notice what's happening. Can you still feel your feet? Can you still feel your breath? Can you still feel tension in your body, and release some of it if you need to? Now we're going to do a little bit of a rotation. So you can either have your arms resting here, or your hands on your hips, or you could have a hand on the chair again, and just without moving your feet, just gently turn towards the side. Whatever feels good. And for this one, we'll do one side and then the other, as long as you feel fine. If you feel like this makes you dizzy, then what you could do is just do one side a number of times and then do the other side. If it feels okay to do one side to the other, then do that. If it feels good to do one side a number of times, then repeat it, do that. It's a little bit about finding what's right for you, about modifying, right? The success with this is modifying what you're doing to serve you best. Then pause again. If you're okay with it now, what I want you to do is have your feet just a little bit wider. So if you happen to be standing with your feet right under your hips, just take them a little bit wider. Have a look down at your feet, and they should sort of be pointing towards the front if you're okay with that. One hand might still be on that chair. But you can feel your feet on the floor, and you can feel the length of your legs and the length of your spine and the length of your neck. If you're okay with it, take your arms straight out to the side this time, and we're going to try a rotation from here. And so we're going to twist to the side and come on back down, or come back to the center again, twist to the side, come on back to the center. And just do that a few times. If you feel like your arms are running out of strength, arms are running out of energy, or you're getting tension building up, it's okay to let your arms down anytime you want to and continue to do a bigger movement of rotation. If you're okay with having your arms out, then try the other side now. While you do it, you're paying attention to your breath, keeping your breath flowing. You're paying attention to your body tension. If your body tension is building, you can pause or work on releasing it more. If your shoulders are starting to creep up, see if you can let them relax down. Now let your arms come on back down again. Come back to your breath. If your body is getting tense again, see if you can let it go. If you need to shift it all, go ahead and do that. We're going to try a little bit more of a side bend this time. So once again, if your hand needs to be on the chair, or if that feels best, doesn't need to be there, you can just want it to be there, then start there. Feel your feet on the floor. Feel the length of your spine. Either one hand on the chair and the other arm straight out to the side, or if you're okay with it, your arms can be both straight out to the side, and side bend from here this time. So you're going to side bend, more movement in your spine this time. Just one side at a time. Go to the spot that feels like the just right spot. And remember, if your arms get tired, it's okay to have them down and move into a further side bend, this time feeling your hands slide down your leg. Let's try the other side. So same idea, down the other side. And now if you like more movement as you go down to the side, you can even look up to the sky and bring your other hand way up to the sky if that feels good. If you try it and it doesn't feel right, then come on back to this movement. If your arms are getting tired, then let them come on back down again. Put your arms down, give them a bit of a shake again. We're going to try a different forward bending again. We started with the rounding of the back. This time, what we're going to get you to do is come forward from your hips. So put your hands on your hips, get your spine really tall, and you're going to, it's like you're bowing forward. So I'll show you from the side. Your spine is tall, you can feel your feet on the floor, you can feel your breath, your hands go on your hips, and your chest comes forward and your butt goes back. And then you come on back up again. So you're bending here at the hips as you go forward, and it may just be this. It may be a little bow, or it may be a bigger bow. Whatever feels right for you. Keep your breath flowing as you do this. Try not to hold your breath. And if your body gets tense, maybe you can keep your breath, use your breath to keep your body from getting so tense, or maybe you need to change how far you're going. Maybe you're going too far and you shouldn't bend so far for now. It's not that it's bad to bend that far when your body gets tense. It's just the idea of trying to teach your body to be able to keep your breath flowing and your body tension low to create more ease of movement. If you're still doing that movement, pause again now. And then we'll try the other way backwards again. So we're going to do a bigger movement with a back bend this time. Hands on your hips again if you feel okay with it. And this time you're going to bend back from the lower back. And this time you really need to look in front of you. So look at something that's in front of you. Keep your eyes on that spot. Either do a little movement, or if your spine is okay with it, your hips and your back are okay with it, you can do a bigger movement. Whichever you choose, you're keeping your breath flowing. You're keeping your body tension as low as you can. If it's getting tight, you can modify the movement. You can modify your breath. Or you can say, that's enough for right now. Pause again for a moment. If you're standing, check in. Is your breath calming back down? Is your body tension getting low? Would it be best to sit down for right now? Would a rest work best to help you succeed with carrying on? Or maybe it's time, that's enough energy for today. For those of us who have chronic pain and the fatigue that happens with it, as much as we pay attention to the pain and our body getting tight and our breath getting tight, or our mind starting to say this is a bad idea, we need to pay attention to our energy as well. So with these gentle movement practices, we hope that you can watch that amongst other things. You can feel your feet on the floor again. You can feel that length of your spine again. Now this time what I'd like you to do is do a little bit of a squat. So you can have your hands on your thighs, keep your breath flowing. Those areas where your body tends to get tight, so you can keep them relaxed, and come down into a gentle squat, and then come on back up again. Just this movement a few times. Now it might be small, or it might be bigger. So from the side, it would look like you're coming down towards the squat like this, and then coming back up again. So do it so your heels stay on the floor. If your hand is on the chair, then your hand is there, or maybe both of them. Great. And then pause again. See how your legs are doing. In a moment, we're going to try this again. So think about what happened when you did that. If your breath was starting to get really tight, maybe you were going further than you want to right now. If your breath is getting tight, maybe you need to work on calming your breath better, to get better at keeping your breath calm. Same with your body. Maybe it was telling you if your body was getting tight, that was far enough. Or maybe it's saying, keep practicing to keep your body tension low. Right? If you're running into pain there, decide when you pause, did it calm back down again? Because that's what you're looking for. So We want to try to do this again, but this time with your arms. So the movement with your arms this time will be lifting your arms up at the same time as you're bending your knees. So at the same time as you're bending down this way, you're lifting your arms up. So you do like this. Now it can be hard to do this at first without holding your breath, and that's fine. Whenever we learn something new, we tend to hold our breath and get tight. But if you do it, see if you can find even just a little movement. So maybe your arms don't lift up high, maybe your knees don't bend that far. Maybe the best thing to do is to have one hand, or if both hands are on here, you can do it like this. Or maybe your hands are here and you're lifting your hands up a little bit while you do it. Right? There's so many different options you can use to morph what you're doing. If you're still doing it, pause again. Move your shoulders around a bit, move your hips around a bit, see if you can let go any tension that's there. Come back to your breath again. Come back to feeling your feet on the floor again. Feel the length of your spine. Feel your neck getting a little bit taller. Any tension you have in your body, see if you can let that go. So maybe the best thing to do right now is to come back into the chair. I'm just going to sit on the edge of my chair at the side here for a moment. Just give my legs a bit of a break, give my shoulders a bit of a break. Now, if I was there, I might decide that's enough for today. I'm going to carry on because I want to show you how to do more. If those of you who are ready to do more want to do this, we're going to try a couple more things, but not too much. Just pause though, regroup. Like you needing to catch your breath. So catch your breath. If there's body tension, let it release. And then we'll come back and we'll try a couple more things. It'll give us a little bit more effort. So the next couple of things are back to standing again. You're going to find that they require some more muscular effort. They may be more challenging for you. So remember, as you're doing this, it's not just about getting the activity done. You're doing your best to keep your breath as calm as you can, to keep your body tension as low as you can. You're paying some attention to the pain so you don't crash right through it or ignore it or pay too much attention to it. That's not the great thing to do either. And if energy and fatigue are issues, you're making sure that you have this feeling that when you stop, you'll be able to regroup again. So come on back up to standing again. So once you get to standing, this time what I'd like you to do is to take your feet further apart than your hips. So make sure you feel okay with your feet further apart than your hips. Put your hands on your hips again. And we're going to side bend again. This time when you bend to the side, you might feel it on the inside of the thigh or the hip that you're working on, because those muscles might be a little bit tight for you. Now you can do this. If this feels good, stick with it. Just small movement, keeping your breath flowing, keeping your body tension low, paying attention to the pain and energy. If you want to go further, you can take that other arm up and even reach it across over your ear, or as you bend to the side, you can just reach your arms straight on up, whichever you prefer. Just do it gently. Just go to the spot where you feel like that's enough, and then come away again. That's the spot where my body is saying, yeah, that's a good challenge for today. Then pause, let your arms relax again. Remember, if your hands need to be on there, keep them on there. You could have your hands on the chair right in front of you and bend to the side like this. If your chair's not there, hands on your hips for a moment. Start with side bending to the other side. Keep your breath going. Keep your body tension low as you bend towards the side and come on back up again. You can feel those feet on the floor. You can still feel your spine straight or tall as you bend to the sides. It won't be in the straight position, but there's a length of your spine as you go to the side. You're not just collapsing down. If you want to take that opposite arm up to give more of a stretch, go ahead and do that. Great. Next time you come back to the center, just let your arms relax, bring your feet back together again, give your hips a little bit of a circle or shift around. If there's tension building up, then pause. Come back to that calmer breath, release tension in your body. And put your hands on your hips again. Feel your feet on the floor, feel your legs long, feel your spine long, hands are on your hips. You're going to shift the weight on top of your left foot to start and bring your right heel on the inside of your shin so the toes are on the floor, either all the way on the floor or just the tips of your toes are on the floor. And then put your right foot back down and do the same thing with the other side. Just shift the weight to your right foot. Bring the heel of your left foot to the inside of your right shin. Either the tips of your left toes are on the floor or all of the toes on the floor and bent. And then put your foot back down again. And just do this a few times. Shift the weight to the side. Keep breathing. Put your heel on the shin, your toes on the floor. Then put your foot back down. Do the other side. The heel comes to the inside of the shin. The toes are on the floor. And you put your foot down. Now that you've got this movement, check in with your breath and make sure your breath is still flowing. Check in that your body's not getting too tight. Remember, you can pause anytime you want. You don't have to wait for me. While you're doing this, I want you to try to do one more thing. Stay really tall. So as the weight goes over to that leg, don't let yourself collapse down. Stay really tall. And then shift back to the other side, bring that other heel over. Stay long in the leg, long in the spine, soften the shoulders and the face, and put that foot down. And then pause again. Let your shoulders go, move them around a bit, move your hips around a little bit. Maybe take a rest in the chair, whatever feels like the best thing to do. We're going to try that again, but this time what we're going to do is a couple different variations. The variation this time is going to include when you bring your foot over, maybe you felt like more challenge would have been better. And if that was what was going on, this time instead of bringing the heel to the inside of the leg, put the sole of your foot against the inside of your calf and then put your foot down. And then you'll do the other side, put the sole of the foot on the inside of the calf, put it down. Now, if you try this and you're feeling like it's more than you're ready for at this point, it's fine. You can get to that later. Stick with the heel on the floor. Sorry, the heel on the shin and the toes on the floor, and then try the other side, just like that. All right. So either you're going to shift on over, put the sole of the foot on, or just the heel on the inside of the shin. All right. So come back to that midnight standing again. Soften your shoulders a bit, then put your hands back up, let your breath flow. Shift your weight to your left foot. Either put your heel or the sole of your foot on the inside of that other leg, and take a couple breaths here. Stay really long with your leg, long with your spine. Do your best to keep your breath flowing. Keep your hand on that chair as much or as little as you can. And then put that foot back down again. And then try the other side. Shift your weight over to the other side. Stay long in your leg, long in your spine. Put your heel or the sole of your foot in the inside of that leg. Breathe. 1 or 2 or maybe 3 breaths here. It's okay to put your foot down. It's okay to lose your balance. Put your foot down again. We'll try one more each side. Stay long. Keep breathing. Keep your muscle tension low. Heel or the inside of your foot on your left leg. Keep on reaching a bit. Keep on trying to find softness in your breath and your body. And then shift your weight back over, foot back down. One more time to the other leg. Left heel or foot on the inside of the leg. Get long in the leg, long in the spine. Keep your breath going. Remember, you can put your foot down before I say, and if you feel yourself shifting around, it's all right. And then put the foot back down to the ground. Move your hips around a bit, circle them a little bit. Maybe bend forward, give your back a bit of a stretch this way, or maybe bend back to give it a stretch that way. Circle your shoulders around, move your head around a bit. Just release some of the tension before we come back to a seated position. So once you're finished stretching, and don't rush if you're still doing it. If something feels like it still needs more stretch, keep going and catch up when you're ready. It's okay. When you do get back to that seated position, feel your feet on the floor. Feel that gentle length of your spine. Notice what's happening in your body. If anything feels tight, just move it around a bit, shift it around a bit. And then come back to that 3-part breath that you did at the beginning, or the 2-part if that felt best. So if you come back to the 3-part breath, expand in your belly, then expand in your ribs, then expand in your chest. As you breathe out, release around the chest, release around the ribs, release around the lower belly and torso, lower torso. So you breathe in, you expand from the bottom to the middle to the top. As you breathe out, you release from the top to the middle to the bottom. Think about your whole torso, front, sides, and back, the whole 360 degrees of that circle expanding as you breathe in, the bottom, then the middle, then the top, the whole 360 degrees of the circle releasing as you breathe out from the top to the middle to the bottom. Then as best you can, just let that breath go and just come back to your normal, easy breath. If it would feel okay to close your eyes now, or maybe you need to soften your gaze on something in the room because maybe it feels most safe to keep your eyes open. Choose whichever one. The idea is to draw your attention inside for a moment so that you have time to notice. Take the time over the next minute or so, notice what's happening in your breath now. As best as you can, let your breath just be. Take your mind to that spot where you can watch what's happening inside you. Notice what's happening in your breath now. Notice what's happening in your body now. So notice the sense of energy in your body. Notice any tension in your body. Scan from your toes all the way up through your body to your nose. Then check in with what's happening in your thoughts right now. What are you thinking about now? What have you been thinking about during this practice? As best you can, don't think about these things. Just see if you can notice your thoughts. It's so hard to do, but give it a good try. And then shift over to emotions. What are the emotions that are there right now? What are the emotions that have been there during that practice today? And then for a moment, take your attention to your heart. Notice what's happening there. And if it's okay, if you feel okay doing it, take your attention to your pain for a moment and notice what's happening there. If you need to shift anything again or move around, go ahead and do that. We're going to end the practice with this for today. I hope that you can keep working on practices like this. As you can see, we're continuing to focus on moving the body while we keep our body tension low, while we breathe in certain different ways, because there's so many different options. So we're hoping that you'll be able to keep on trying these, keep on using these, really so that you can find ways to move with more ease and to live well again.
Thank you, Neil.
You're welcome, Jen.
That was a great practice today. I hope everyone got a lot out of that. I certainly did. Neil, we had a question, and it's a little bit out of context now because it was a question about one of the postures, but
okay.
I'm going to read it. And sure. So it was just, and you can maybe just sort of review it just to clarify things for next time. So someone was wondering if the knees are loose in standing bends. I'm not entirely sure. Yeah.
Right. Yeah, this is a great question because a lot of times when we're standing, what happens is we start to stand with our knees sort of in that somewhat hyperextended or sort of locked back position. So what we'd want to work towards doing is, there's so many other things that we can add to this, but I think it's a great idea is that while you're standing, if you feel like your knees are sort of relaxed back and are in that sort of locked position and there's a strain on the back of the knee, it would be great to just try to find a little bit of a bend or a little bit of softness. Really the idea is how not to be in that hyperextended or knee sort of jam back position. I think it's a great idea to, in all of the standing positions, to try to find a little bit of that softness in your knees while you're doing it.